Welcome to this clinical walkthrough on the Raynaud's phenomenon case for UKMLA, brought to you by Medi8, your 24/7 practice partner. We're going to get you absolutely ready to master this key OSCE station. Let's jump right in.
All right, so what are we doing here today? Well, the goal of this whole explainer is to give you a really clear step-by-step guide so you can walk into this OSCE station feeling totally confident. We're going to cover everything, from the moment you say hello right through to wrapping up with the management plan. By the end of this, you'll have a rock-solid framework to fall back on.
So here's our game plan. We've got 6 sections to cover. We'll start with the station setup, then dive into the history, screening, examination, management plan, and finally, a wrap-up. It's basically our roadmap for the whole consultation.
Okay, Section 1, Station Setup and Introduction. That first impression is absolutely critical. A strong start builds rapport and really sets the tone for the whole thing. Let's talk about how to nail it.
So here's the setup you're going to walk into. A 28-year-old woman comes in talking about these really painful episodes in her fingers, and it's always the cold that sets it off. Your task, take a history, do an exam, diagnose her, and come up with a management plan. It's a real classic OSCE case, so let's get into the nitty-gritty.
This is your opening line, something exactly like this. It's polite, it's professional, and it's totally patient-centered. You confirm who they are, and then you just open the door for them to start talking. It's so simple, but honestly, it's such an effective way to kick things off.
All right, next up, mastering the history. This is huge. This is where you're going to find all the clues you need. A really structured approach here means you can pretty much have your diagnosis figured out before you even touch the patient.
So your history needs a logical flow, right? First things first, characterize the complaint. Use something like SOCRST to get all the details on the pain. Next, and this is key, you've got to ask specifically about that color pattern. And finally, you'll ask about other symptoms, things that might hint at complications or a secondary cause. Following these steps means you won't miss a thing.
Okay, let's talk about the crucial question. The classic color change is the absolute hallmark of Raynaud's. But here's the thing. Patients often won't just tell you about it. You have to ask, and you have to ask in the right way. So how do you do that?
This is exactly how you should phrase it. It's perfect. You're using simple, direct language. First, you just ask if there's a color change, and you give them examples, pale, blue, or red, which really helps. Then you follow up about the pattern, the sequence. That's how you nail down that classic white, then blue, then red progression.
Okay, so you've got the main story. Now you have to put on your detective hat and screen for the serious stuff. We're talking complications like tissue damage, or maybe something bigger, a systemic condition that's causing the Raynaud's. Let's look at how to screen for that.
And these are your go-to questions for that. The first one, about ulcers or slow-healing wounds, is all about checking for severe ischemia, major complications. The second one, about joint pain or rashes, is your opener for screening for those secondary causes, things like connective tissue diseases.
Perfect. So that leads us right into our next section, screening and patient concerns. We're going to dig a bit deeper into ruling out those red flags, but just as important, we're going to talk about the patient's perspective. Getting that holistic view is so important.
This table is basically your cheat sheet for screening for secondary causes. See how it links the symptoms to the conditions? If they mention morning joint stiffness, you're thinking rheumatological. Dry eyes and mouth? That could be Sjogren's or a systemic sclerosis. And things like trouble breathing or acid reflux can be features of broader connective tissue diseases. It's all about being systematic with your questions.
Look, a really good consultation goes beyond just the medical facts. You absolutely have to understand the patient's world. So ask about risk factors, smoking, their job, that kind of thing. And then you have to use the ICE framework. What are their ideas, their concerns, their expectations? Honestly, this is a non-negotiable part of a high-scoring performance.
Right. You've got your history, which is packed with clues. Now it's time for the exam, and then the big moment, delivering the diagnosis. Let's get this right. When it comes to the exam, you need to be focused and efficient. Don't waste time. Start with a quick general look over for any rashes or other signs, then zero in on the hands. You're looking for those color changes, any ulcers, skin tightening, the real red flags. And always finish with a good peripheral vascular exam. Check those pulses and capillary refill. Before you even open your mouth to explain the diagnosis, you need a simple, clear definition ready to go in your head. This one here is perfect. It's got no jargon, it gets straight to the point. The small blood vessels are just overreacting to things like cold or stress. Simple.
And this is how you make the science make sense to a patient. You turn it into a simple, Three-step story. Step 1, white, because the blood vessels suddenly tighten up. Step 2, blue, because the tissue isn't getting enough oxygen. And step 3, red, when all the blood rushes back in. It takes a really confusing symptom and makes it totally understandable.
Okay, let's talk about the delivery. You start by naming it, "This sounds like Raynaud's phenomenon." Then, straight away you reassure them. Using a phrase like, "the good news is so powerful." By saying it's likely the primary type, meaning it's not connected to some other scary illness, you're immediately calming their biggest fears.
Okay, diagnosis delivered. Now for the final, and I'd argue most critical part, the management plan. And notice I said crafting the plan. This is a team effort. It's all about empowering the patient with advice and a clear path forward.
A great management plan always has these 4 parts. It's a simple structure. You always start with lifestyle advice. Then you can talk about medications if they're needed. You cover trigger control, and you finish with really clear safety netting and a follow-up. Easy.
Now, for primary Raynaud's, lifestyle advice is everything. It's not just a nice to have, it is the first-line treatment. So you need to hit these points hard. Keep your hands and feet warm with gloves and good socks. Try to avoid sudden cold shocks, like grabbing something from the freezer. Work on stress relief. And if they smoke, that has to stop. It's a huge one for circulation.
And remember, hearing me talk about it is one thing, but doing it is another. You can practice this exact case right now. Get objective feedback on mymediate.com.
All right, let's bring it all home. We're going to wrap up with the last few crucial bits of the consultation, your safety netting, and how to leave the patient feeling reassured and supported.
Your safety netting has to be absolutely crystal clear. No ambiguity. You need to tell them exactly when to come back. Come back if your symptoms get worse or if you ever see an ulcer on your finger. Then you tell them what happens next, a follow-up in a few weeks. And you also let them know what the next steps could be if things don't improve, like trying a medication or seeing a specialist.
And please end with empathy. Acknowledge how they're feeling. I mean, these symptoms are alarming, so validate that. A simple phrase like, "we'll manage this together," can completely change the feel of the entire consultation. It makes it a partnership. That's how you build trust and make sure they walk out the door feeling like they've got someone in their corner.
So there you have it, the whole framework, from start to finish. Now it's your turn to put it into action. You can practice this exact case now on mymediate.com. Go on, perfect your timing, nail your phrasing, and sharpen up that clinical reasoning. Good luck.